Hey friends, welcome back to the Millennial Outliers podcast. I'm your host, Justin Deal, with my right-hand man and co-host, Tyler Ardron. Ty Guy, what's the good word today?
Doing awesome, dude. Doing awesome.
Love it. Building momentum, second episode of the new year.
Yes, sir.
And we're ecstatic to have, I believe, one of our youngest guests, who's a good friend of ours. He's a partner of Paydays, and he also works in the family business and is kind of carving his own path. So love to kind of shed light on those folks that are doing different things, again, because that's what this is all about, is highlighting folks within our community that are building success on their terms, because success is a symphony, and it depends what it sounds like to you for the definition of it. So without further ado, Bill Webb from Saratoga Benefits. What's up, brother? Thanks for being here.
Thanks for having me, guys. I appreciate it. It's good to be here. Good to see you guys, and I love the setup in here.
Thank you. I appreciate that. So as I know you've gotten familiarized with the podcast, so let's kick it off. And being in a family business similar to mine, obviously there's ways that you have to deal with relationships and things, especially with your mother. It's always a tough thing to have the mom boss partner kind of thing, because it's always an interesting line. But take us to before the business. So tell us a little bit about young Billy, what childhood was like, and then kind of just what that dynamic was.
Yeah, absolutely. So I'm from Morristown originally. I grew up there, with my family, my sister, and my parents. Both my parents are actually entrepreneurs. My mom's been in the health insurance industry since she was right out of college. So she started, doing that after graduating from Lafayette. Worked for a larger company for a few years before ultimately starting Saratoga Benefits 25 years ago out of the attic of our house. So. Right above the garage, it's like Apple and Amazon start out the garage. So a little bit different, but same general gist, right?
Yeah.
And my father's also an entrepreneur. So he was a partner in a software company. He's a great guy, extremely successful, very self-made, and just a great role model as far as the kind of father to be, the kind of businessman to be. He was, kind of the sales guy for this software company, and really has just taught me a lot as far as processes, customer service, how to get, from point A to point B, and how to take care of your customers and work through a successful business and really grow a company. So as far as my parents go, they were both just incredible role models. And have always taught me, it's a blessing and a privilege, and it's really hard to own your own business. So that's something that I kind of always, wanted to do, and have been fortunate enough to been able to pursue in the past few years through Saratoga Medicare Advisors, kind of a spinoff of Saratoga Benefits. With the support of my parents and their guidance as far as entrepreneurship, starting a business and growing and helping people. So
yeah. That's amazing to have that kind of an example. Yeah, to see, because entrepreneurship's definitely become popularized as of recently, but 25 years ago, not so much. So first off, congrats on that. That's amazing. Every decade you're in business, obviously, like the room gets much smaller. Yep. Because the average business in 3 years is folding up shop. So that's amazing in itself. But why don't we jump in there? Because everybody obviously loves benefits and medical insurance and stuff. So it's always a topic of conversation, obviously, with what I'm doing in payroll. So why don't, like, from a 30,000-foot view, like, why don't you just break down the concept of, like, the benefits and what you guys provide?
Yeah, absolutely. So, health insurance in the United States is a complicated topic. Mm-hmm. There's a lot going on all the time, changes as far as healthcare reform, the Affordable Care Act. Now you see, Get Covered New Jersey and the state marketplaces opening up. But one of the main things that employers look for as far as retaining and attracting employees is benefits, whether it be a 401k, dental, vision, life, health insurance, all that. And nowadays, we've seen in the past couple of years changes to, employers and the workforce and working remote and all these things. So attracting and retaining employees has been very important. And a lot of companies are doing that with employee benefits, whether it be, like I said, health insurance, dental, vision, all that. Mm-hmm. At Saratoga Benefits, we work mostly with smaller businesses, pretty much under 100 employees, to help them work within their budget and within the budget of their employees to come up with a benefit plan that is valuable, to both the company and to the employees. It's if you're offering a benefit plan that's extremely rich and a lot of money, but the employees aren't using it, then you're just wasting money,
what's it
right?
worth, right?
So, we try to find the balance there between dollars and benefits for both the employer and for the employees. And one of the main things we try to focus on as well is education. Making sure people understand what their benefits are, how they work, what's a deductible, what's an out-of-pocket maximum, how do these plans work, what's their network, all that. And we try to work with our clients and their employees through employee meetings, whether it be in person or on Zoom calls, to educate them about, how to go about getting healthcare services, being a smart consumer of healthcare, and, making sure they're taking advantage of everything that the plans offer. These are expensive plans. You got to take advantage of them.
Yeah.
A lot of people, especially younger people my age, aren't taking advantage of primary care visits, a free wellness check. Through healthcare reform, preventive medicine is covered in full for all plans. So you can go and get an annual physical just to get a baseline for your health every year. People don't do that.
Yeah.
So we try to tell people, make sure you're taking advantage of this. So you're at least getting some money's worth out of the plan and keeping a baseline for your health, making sure, year over year, you're staying healthy and you kind of have a baseline for, where you are. So that's kind of our goal, is to provide those kind of resources to smaller businesses that typically don't get that kind of maybe hand-holding or service from some of the larger firms. And again, working with smaller and mid-sized businesses, we kind of have our nice niche there, where we're able to work with businesses of different sizes and smaller businesses with different budgets to really make a difference for their staff.
Yeah, definitely with some of the clients that we work on together. I've been in the room when Amy, shout out to Amy, your mom, is giving the presentation. It is very impressive, just the amount of education and knowledge that you kind of dump into these new companies. It makes me very appreciative that I'm only dealing with the business owner and not the employees as well, because it's a lot, right? There's a lot of questions. Everybody has these personal situations that they have questions about that you guys have to kind of handle on the fly. And to your point, it is such a complicated system, right? Like most people don't, they're just like, I know I pay this dollar amount. I have this deductible. I have these, co-pays if I see these specialists. And like, that's kind of all I understand. I don't really know. So, we were talking a little bit before of some of the other things, like our typical like fitness, health, our own accountability, and how important that is, for obviously to help your company and to help yourself with the need of it. Because you have health insurance doesn't mean that you're going to be healthy, right? Like
You're not going to die.
Yeah, it's, as we said, a lot of times, with the medical industry now, they're really just ruling things out, right? They don't always give you answers. So do you guys, do you educate on that as well? Do you talk about personal wellness? And
Absolutely. And, some plans nowadays are including some, wellness type benefits, whether it be some, gym memberships or things like that.
Yep.
So, that's one thing I always, when we meet with our clients, encourage them to do is, download the app, whether it be AmeriHealth or Horizon, whatever it is, and see what those extra benefits are. Because, you might have a gym membership built into your plan that you didn't know about. So important to look at that stuff. But yeah, the looking, big picture as far as, obviously healthcare costs in the US are extremely high. And that's because we're high utilizers. We have a very unhealthy population in the United States. And, as a whole, basically these carriers are looking at the average person, the average claims, and figuring out, what their costs are. So, you may be very healthy. I know we all take care of ourselves and we go to the gym and we try to be very healthy. So, maybe our healthcare costs as far as, going to the doctor and all that stuff are fairly minimum. But the other person who's not taking care of themselves and has, early onset diabetes and all these different things, they're very expensive.
Yeah.
So, the best thing we can do as far as, helping to kind of lower health insurance costs is take better care of ourselves, have a better diet, exercise, not put yourself in a high risk position down the road where, you are at risk for different kinds of diseases, sicknesses, things like that are going to be very costly.
Yeah.
Obviously there's a lot more nuances to that than just, everybody, go to the gym and be healthy.
Yeah.
But, that is one of the main determinants of the high healthcare costs is the utilization by our population in the U.S. So very important to emphasize that. And one of the trends recently has been these level funded plans, which is a kind of newer, nuanced type of benefit plan that actually works off of the claims experience of the employees in a group. So rather than putting you in the whole pool of
Every client,
every individual in maybe the state of New Jersey or whatever it may be, they're just looking at your maybe 20-person company.
Right.
Okay. And if there's, one or two people on that company that have $100,000 of claims, your rates are going to go up.
Yeah.
Where if everyone is being a better consumer of healthcare, right? Maybe going to urgent care instead of the emergency room for certain things, and going to in-network providers and making sure that they're being smart consumers of healthcare and taking care of themselves, that drives rates lower and allows them to stay lower for a longer amount of time. So that's one of those things as far as education, especially when it comes to moving people to these different level funded plans. We always try to stress that to all of the staff as well as the employers, so they can kind of reiterate it and let people know that the way they access their healthcare does have an impact on what their bottom line cost is.
Yeah. And the I guess the unfortunate part is, I've listened to a lot of podcasts about the healthcare system and everything, is that and this isn't a knock on the healthcare system or any healthcare workers, because I'm sure we have some listening, but they don't going through school and everything. Like, they don't learn. Like, listen to a guy who, I forget the Ways to Wellness. He was just on Rogan and everything. And he used to be a doctor, or he still is a doctor. But he said that when he went through school and everything, a lot of people went this way in that learn about, pharma, medicine, and how to cure people and everything like that. And he found it very odd that they didn't focus on nutrition, or they didn't even go over anything with nutrition or anything like that. So it's unfortunate because, we tell people, we just said, be healthy, take accountability on yourself. But it's unfortunate that you can't go to a doctor and that doctor can't prescribe you a health, a meal plan or anything like that. They're just kind of ruling things out. And like I said, this isn't to knock doctors or nurses or anything like that, because their jobs are tough too, right?
Yeah,
like
absolutely.
I'm sure anyone listening has been to the doctors. They're on 15-minute intervals. Like, you got your 15 minutes, you got your appointment. Next person's coming in. Like, they can't really spend an hour with you. Like, all right, this is what you need to focus on. This is what you need to eat. So they're not being educated on it, but also, like, just the way that it is, they're burning through people to because that's what they have to do.
Absolutely. And I mean, that's we could open up a whole can of worms here on all that. There's, as far as doctor shortages and things like that. But yeah, it's it's also supply and demand. Like I said, the United States is a huge. Everyone's using the healthcare system, right? There's a lot of demand for doctor's visits, hospital visits, all that stuff. And with that, as supply dwindles of doctors and demand by the population goes up, the costs are going to rise as well. So, encouraging people to go to med school, which goes into, we were talking, I heard you guys episode before talking about college and everything, the cost to become a doctor is astronomical.
It's
and the
insane.
the time aspect of it is insane.
Yeah.
And, we have a shortage of doctors. So we need to be encouraging people to go into that field and make sure that we're solving that problem and making sure we have a better supply of doctors, because the demand is there. We just need, more people to be in the field. So it's not, maybe a doctor could spend half an hour with you instead of his 15-minute come in, hit your knee with a hammer and then head out.
Listen to you breathe.
And I really think they should kind of reinvent schooling for doctors, because they really don't teach them anything about business. So if you want to go into actually run your own private practice compared to working for a hospital, and most of them fail at it because they don't really understand. They're an amazing doctor. They know that specialty, but they don't know the back end of running a business.
Absolutely.
Especially in that world, with billing insurance companies. And I've heard it from doctors. They're like, I don't know what I'm getting paid on this because I billed, Aetna. They're only going to pay $800 as opposed to $1,300. So I got to, invoice it higher to make sure that I'm getting paid.
Yeah.
It's like a whole thing.
Yeah. And I mean, to Justin's point, one of the trends, if you look over the past, 20 years, is kind of the downfall of entrepreneurial medicine, right? Opening your own practice. All right. And there's many factors to that, right? Malpractice insurance is astronomically expensive.
Ridiculous.
The there's all these practices are now getting bought up by, virtual advocare, whatever it may be. And, that's not all bad, but the consolidation of that has kind of taken out the entrepreneurial aspect of having your own private practice, where now you graduate from medical school and you're going to go be an employee as a doctor, at a large firm versus owning your firm where you have a little more control, and you can grow your practice by yourself rather than being, controlled by a larger medical group.
I agree.
So,
and just like as a PSA to business owners, right? Because like I said, I always hear people that complain about the costs, but also think about like what is the example and the culture that you set within your business. Like we were talked about on previous ones. I'm very vocal in my business about doing 75 hard each year, and I talk about my fitness journey, and I try to inspire others to do it, and it's so they better their lives, so they can create healthier lifestyle, and it helps everybody, right? They have a better, health rating, everything goes there. They maybe are in a better insurance category now, that drops down. So we can't always just paint or point the blame at the carriers and at the companies. We have to think of what are we doing, right?
Yeah.
Like, I argue with my mother about this from time to time. I'm like, she comes in and she's bringing cookies and donuts and pretzels. And I'm like, bring fruit and bring salads and like give our people healthy options. Now, obviously not everybody's going to eat it. If you follow me, you saw we did W2s not too long ago.
A donut day or something.
Yeah, and they wanted donuts and they wanted pizza. And if you saw, I had my salad, I had my healthy stuff on the side. So we have to, again, own it. What is the example we set? If we're not healthy ourselves and we're the leaders of the company, we can't be pissed off that everybody else in the company isn't healthy because we're not aspiring or inspiring anybody to do it.
Yeah.
Absolutely. So, Bill, I do have a question about, do you deal with like the self-insured companies often?
Yeah, a little bit. Yeah.
Can you just like explain that a little bit? Like who is a good fit for the self-insured? Is that?
So it really depends on the company where they're looking to go as far as their size. Usually it's, a larger company.
Okay.
Now with that's similar to the self-funded, level-funded plans, which are becoming available to some smaller businesses. With that, as some carriers have rolled out these self-funded and level-funded plans, they're again looking at claims experience from the group in the past, and sometimes. Like AmeriHealth, for example, and Horizon, a bunch of the carriers have these level funded plans, and they'll look at the claims experience from a group, and they'll offer, them to switch to this plan without any really paperwork or, too much, back office work. Other companies, to switch into it, they have to do what's called IMQs, which are medical questions, individual medical questions. And that's basically a form that everyone in the company needs to fill out about health history so that they can underwrite and actually look at, what the expected costs are for those groups. So that's becoming more popular with smaller businesses. I think there's a lot of room to grow in that industry. And like anything with health insurance, there's always constant change coming. So that has been kind of a hot topic of the past couple of years. And I think it will continue for a few years. And we'll see how, that all ends up. Typically, in my experience, these products come out, they're great. They save everyone money for a few years. And eventually the rates raise up. Something new comes out. Everyone switch over, and it's a bit cyclical. That being said, we've seen major savings in the past couple of years with those self-funded and level-funded plans, to the point where it doesn't make sense not to go with that option. Go with that. You'll save X for a year or 2 years, and even if you do get a 30% rate increase, you're still going to be under where you were last year.
Right.
So that has been a very popular trend over the past couple of years, and something we're definitely exploring with a lot of our clients.
Now, I got a question on that, just so I'm clear, because most people know I own an insurance brokerage. I'm on the P&C side, though. So you said self-insurance. So, in my world, self-insurance is you're putting money away, and God forbid your house burns down, you're going to pay for yourself. But it sounds like you're like naming health carriers and stuff. So is self-insurance, is that a plan through insurance companies?
It's a kind of a plan design, to a degree. So it's it's a little bit, it's different the way it works than your standard insurance, where there's a lot built into it, like on the back end, as far as protecting from high claims and all this stuff. So there's like stopgap coverage and a bunch of different things kind of on the back end to the consumer. And really to the employer, there's not much of a difference at all as far as the coverage goes. It's pretty much identical, but it's really the back end design of the plan and how it's set up, where they're estimating kind of a claims number for where they expect groups to end up. And depending on where they fall, if they're less than that,
the rate's based off that.
Exactly. And if it's higher, then, the rates will go up.
Right.
So there's a lot that goes into those plans, as far as, reinsurance and different things like that on the back end, to prevent, high claims and a loss from the insurance carrier. And again, they're aimed at, kind of lowering the cost for the employers. And what's also nice about those plans is that they're providing 4-tier rates. So with most small businesses under 50 employees, their rates for their health insurance costs are age rated. So if you have a 60-year-old employee and a 25-year-old employee, the 25-year-old employee's premium is going to be significantly less than that 60-year-old. Right. With these self-funded and level-funded plans, they're getting 4-tier rates where it's the same rate for a single person, whether you're 25 or 60, parent-child, parent-spouse, and a family rate. Okay, so Justin, you both have a lot of kids, right? Yeah. So if you were paying for each one individually, it get pretty expensive. Oh, whereas if you're just paying a flat family rate, it doesn't matter if it's a husband, wife, and one kid, or a husband, wife, and 4 kids. Yeah. Okay, so it's really nice, as far as administrative wise, exactly what the rate's going to be for everybody. It's very standardized, whereas with a lot of our other small business clients, we're going through their entire census.
Confusing as hell.
And having to, the rate is different for everybody, and the payroll deduction is different for everybody. So, so they are nice, administrative wise, and they've definitely been a big trend over the past couple of years.
Love it. So let's make a quick right-hand turn here, and we'll get you off the hot seat with all the medical
health
questions. Talk. Yeah. So we love talking about life, and one of the things I really enjoy about you is that at a young age, you've built a lot of freedoms for yourself. I love talking travel and things like that. So let's start with, you recently got married. Congrats on that.
Thank you. Big congrats, dude.
Yeah,
so
thank you.
Talk about the wedding, talk about the honeymoon, and kind of what you guys did.
Yeah, so it was amazing. I mean, my wife, Nikki, is great. Shout out to Nikki. I'm sure she'll be watching this soon.
Brownie points,
she's, yeah, exactly.
Good move.
So we just celebrated our first anniversary, January 7th.
Oh my God, it's been a year already.
Yeah, it's been a year.
Crap.
It's been a year. So time flies. But yeah, wedding was amazing. My in-laws are great, and they did a fantastic job, as well as my parents. It was a full family effort. I've got my wife has 2 sisters and a brother, so they're very involved, and great speeches from everybody. So it was an amazing day and a great party with a lot of our friends. So definitely something I'll remember, and one of the best days of my life. So
it's awesome.
A great time. So we were fortunate enough to one of my wife's friends actually got married in Italy this summer. Mm-hmm. So we got to go to Italy for that wedding and made that kind of our extended honeymoon, which there's a little bit of a healthcare story in there. One of our friends on the wedding had a bit of an accident, and we got to see the healthcare system in Italy.
Over there. How'd that go?
Which is it's interesting. It's they have universal healthcare over there, where it's free. Yeah. And you definitely get what you pay for. Mm-hmm. They're looking at, she had a finger injury where she smashed her finger, and it was not good. But it ended up being okay. It didn't ruin the trip or anything.
No cast or anything?
No, no cast, just a wrap. But they're looking at it. The doctors have their iPhone flashlight looking at the finger and everything. And,
that's a bad luck.
Yeah. So it was interesting. And actually, the one guy we were traveling with, his cousin lives in Italy. And he was telling us, they have, there's the universal healthcare and everything, but they also have private healthcare where they pay for, better access to better doctors, to all that stuff, where, everyone talks about Medicare for all and all that stuff. Mm-hmm. And if that ever does happen, there's still going to be a private healthcare market where people are going to want to go to top doctor and all that stuff. So it was interesting to see that, up close and personal, and have that experience. But outside of that, the trip was amazing. Italy is incredible. And, we're looking forward. We don't have any kids as of yet, so we're going to enjoy that for another few months and get some more travel.
A few
months. Yeah. Well, that's what I think people miss, that it's so important to travel the world and experience other cultures, and even like you just said, to experience what your industry looks like, in a different part of the world. Because it just brings so much light, and it reminds you just how good we do have it here and how grateful we should be for a lot of the things we have in America. Because my kids have traveled the world as well, and it's like we've seen real poverty in Haiti, and we've seen the villages in Italy where nobody speaks English, and you're playing charades because you can't get to your Google app because there's no Wi-Fi, and it's just, you see the architecture and you see the importance of family, right? Like over there in Europe, there's just family is definitely at the center of everything that they do. Where here, I think we're driven by finances a lot of times, and we will sacrifice family to hit the finances.
The food.
The food is all right. Our FDA is a joke compared to what they do over there,
like
because
right
everything's
over there,
fresh.
Completely different macaroni and stuff.
Anybody you talk to, you obviously walk around
Pizza
on there, which is great, but you eat the whole time, you drink wine, you enjoy all the stuff, and
nobody's
you come
fat.
home. But you
go over
come
there, nobody's
home from
fat.
there and you lose weight. You're like, I've literally been like eating everything I wanted to, drinking, enjoying life, and I lost a couple pounds. You're like, I eat one friggin' meal in the U.S. and I gained 7 pounds in a day.
Live off sugar.
Yeah, it is. It's crazy. So I'm glad that you guys that's a priority for you, is getting out, enjoying the world, and especially because it's exhausting with kids. So do it as much as you can, because my wife and I will go back and we'll do it later in life, and Italy and all these countries will be a completely different perspective without little ones that I'm chasing and constantly distracted by.
Absolutely, yeah. So it's been great traveling around and everything, and we've done a little bit of travel. I definitely want to do some more. That's been kind of a goal this year. We're doing a little trip to Mexico in a couple weeks, which will be nice, and that's just kind of a relaxing trip. But we're trying to figure something out for the summer where we go maybe back to Europe or something, and bop around and really get a nice fun Euro trip under.
They got those. I went to Europe probably about 8 years ago, and they have that Ryanair or whatever. And dude, it's like
$50 to jump from like one country to the next.
Yeah, it was like back then. I think it was like $40. It was like 10 years ago. It was like $40 to go from the Netherlands to Ireland, and then we went. It's just crazy how cheap it is.
That's my younger brother. I've shared before. He lives in Poland, and his girlfriend lives in Paris. And they they go see each
other. It's like a train ride.
Every other weekend.
$40.
No big deal. Quick flight. But it is. It's great that you do that, and I also want to talk about another one of our common interests, which is shoes. I think, we're both sneakerheads. We both collect. So I tie too. You dabble in there, but you like your watches and cars a little bit more. What anything that you're excited for launches this year? Any drops?
Oh man, I've been a little bit out of the game. I got my I got Jordan 1s, Jordan 2s, Jordan 3s, and Jordan 4s. Mm-hmm. And those are, as far as I'm concerned, those are the four best pairs
for you.
I've got. So now that I've got them, I haven't bought a new pair of shoes in a little while.
Okay.
But and those are, I've got a couple pairs of ones and everything. My wife is telling me that I gotta dress a little nicer and
how dare she, Nikki?
Let them you see people now though, like they're wearing Jordans and suits and stuff. Like it's like way different than it was 10 years ago.
Absolutely. And I believe me, I love I'd be wearing Jordans with this. But I've got a couple of things going on. But,
you got to dress to the clientele.
If it's an older client, then you don't want to
doctors and things like that.
And especially with us being younger, you do got to you don't want to have that stigma too. Of,
absolutely.
If you're meeting with a business owner who's 50, you don't want to show up in the Jordans. At least I don't want to.
Wow, fun story about that actually. So one of the first deals I'd worked on with Amy.
To preface, my parents are old school.
Yeah. And as is my mother, it's a contention between us. My mom's always dressed to the nines. She looks like she's ready to go to a ball at any time, and I look like I'm ready to go play ball at any time. And so, long story short, new client. They're down in Delaware. I show up, and like I typically do, payday hat, some Jordans. So they got a payday hoodie on, some jeans. No big deal. Because Bill forgot to say to his mother that I always wear hats. I walk in and I could just see it on her face that she was mortified. And I was like, and it was, it wasn't like a crazy professional thing. Like the client was just like most people were in pretty plain clothes.
Right.
And she was like, "You got to at least take your hat off." And I was like, "Do you know what my hair looks like?"
You don't want to see that.
I have a hat on.
I feel your pain.
I did it to blush. And it's one of those things, like, I've always had the mindset that the knowledge that I have, the energy that I bring to the room is really what I'm like. And I hope people don't always, judge me on my threads, but some people
They do.
They
Yeah,
absolutely.
yeah.
It is a first impression at the end of the day.
Yeah.
I always try to tell myself, because I'm so color coordinated, that I get extra points, but apparently not.
It's logo wear,
Not with Amy.
It's
Not with Amy.
Not with Nene either. Every once in a while, I'll get, "Oh, you look nice today." And I'm like, "Nice, I did."
Wearing a sweater.
Yeah, exactly.
To the shoes thing, did you see the Cactus Jacks, the yellow and they look fire.
They
I want
look
them so bad.
There's so many pairs
The yellow
of
with the
shoes that I
blue.
need in my life.
They're coming out, I think, in March. Maybe is what I saw.
Okay.
They're
Sure
they're new
drop.
ones. It's his high school colors.
Oh, okay. Is that
So
what
they're like yellow and like baby blue, but
Yeah.
yeah, they look sweet.
everything
They're just so
he's
hard to
been
get,
putting
those
out is,
Cactus
They
Jacks.
only put like 1,000 of them out.
I know, but I want them so bad.
So let's also, so I know it's been a year again, but
Yeah.
bought a house.
Yeah,
And you've renovated most of it yourself. And to my
Yeah.
knowledge, you aren't a super handy guy, right? So how'd you pull that out?
I mean,
Now he is.
I-
Well,
now
that's what
I
I'm
am.
saying.
Now I
You
am,
figured it out,
exactly,
right? But like,
exactly.
talk
So,
about that, because I think so
I
many
mean,
people want turnkey.
That's always been a goal for me.
Mhm.
Yeah, I
Is to
remember.
renovate a house, and I got a taste of it with this. We got a nice townhouse, and it was one where the owner had passed away. The house had been vacant for over a year.
Mm.
It had the chair lift that goes up the step.
Oh,
There
stylish.
was,
man, it's a perfect flip.
railings
Yeah.
all over the place, and everything was brown. So
Mm-hmm.
it needed, basically, more or less a full renovation, new master bathroom, some new floors and
Kitchen.
backsplash in the kitchen, but the countertops and the appliances were okay. Refinished floors. The guy had pictures hung. He probably had 10 pictures hung in the bathroom. So picture holes everywhere.
Been there.
So yeah, so it was definitely a learning experience. A lot of YouTube. I loved it. I mean, it was.
You took a
one of the
wall down
most-
too, didn't you, in the kitchen or
We
something?
had
I
a
remember you
full
telling
wall
me.
that I took out and turned into a half wall and everything. So
Yeah.
a lot of help from a lot of people. My parents were helping a lot. We painted the whole place, basement to ceilings, everything.
Yeah.
Painted the whole house, which I thought when I bought it, I was like, all right, we'll finish painting in a week, 10 days. 2 months later, we're still working on the painting. So
Painting's the
but
worst.
The worst.
Painting's the worst.
Especially
But,
the lower half of the wall.
Yeah. And
Well,
the
that part's
molding and
easy.
all that stuff.
The higher part for me is
Yeah.
They will work together. So half and half.
but that was now it's basically done. We have the punch list of small things that I could finish really at any time, but I'm just gotta get around to doing them.
Yeah,
but
get motivated.
it was extremely rewarding. Especially when Nikki first saw the house. She was like,
That's the hardest part with
I don't know.
what I've
Selling
learned
the vision.
in the real estate
Yeah.
is the selling the vision to the woman.
Yep.
That is very difficult.
Yes, and it looks incredible now. I mean,
That's awesome,
It's great. It's when I have friends over and they tell me it looks great. It's
A lot of pride.
Feels
It's appreciative.
amazing. A lot of
Yeah,
pride. Yeah.
pride.
So I'm really proud of the place. I think it looks awesome. It's
awesome,
not
dude.
our forever home. It's a 2-bedroom townhouse, but
Does the
I
job
think it's going
now.
to be a great investment and
I assume you'll keep that.
an amazing place. We actually can't keep it because there's some rules as far as renting them out.
What'd you do,
I
FHA?
would have to live there for 2 years, kind
and,
of a thing before.
They don't.
But yeah,
They
I
won't,
don't at
Jack.
all.
yeah. So,
I've done it.
Well, we have. Well, it's rules within the HOA as far as renting it out. So you're allowed to rent it out for 18 months and then not again for 3 years.
Wow.
Which I didn't.
That is brutal.
I know, and I didn't know that when we bought it, but
oh man.
I still think.
Well, you still got you got a ton of equity from
yeah.
rehabbing it. Did you do a like a 203K loan to help you, or did you?
We did not. No.
So you got a ton of equity right now in that place,
Yeah.
you know.
Yeah.
And you
absolutely.
bought in what year?
December 21.
Okay, so the
So,
market was coming
great.
up a little,
Yeah, but still very
not like
good.
where it
Not
is
like
today.
where it
Dude,
is
you could
now.
probably sell to make 200 right
Yeah,
now.
hopefully.
You probably could.
Hopefully.
Yeah.
We'll see. I mean, there's been some comps that have that are comparable to that, but we'll see where we're there for a little bit. It's perfect for us right now. I mean, we got plenty of space and the bedrooms are huge. We just bathroom's nice. Everything's great. So we're
That's
not
awesome.
And it's right up the street from my office. So
perfect. Can't beat that.
Yeah, exactly. It's right on Main Street in Morristown, and our office is on Main Street in Morristown. So I'm happy.
Yeah.
But yeah, it's funny. Now I'm always on Zillow looking around at seeing what's out there, and it's like one of those things. You get one, and then you got to get another. So I'm looking forward to having like an actual house with a yard and the whole nine.
Yeah.
So, but we've got a couple things to get through before we get there. But
once you start having the kids and stuff, then
it becomes different priorities. That's why I had a nice little reality check yesterday. I was just like looking at a couple different things. I'm like, what's the next thing I need to like hyper focus on?
That I want for
baby. Like, the family, right? I was like, maybe the next house. Right?
Dude,
so
town and country.
But I was like, let's see what kind of 5-bedroom houses are available on the market. And I was like, nothing under $1 million. Like I just don't.
You come on down near town and country, buddy.
True.
Be neighbors over there.
That's true. It's nice some good land and stuff.
Yeah.
The market's
God's country.
definitely in an interesting spot right now.
Yeah, but I tell people with that, because so many people are on the sidelines with that type of stuff, and I mean, there's never like a good time.
Yeah,
you know what I mean? Like if you're waiting for rates to drop, well, what's going to happen is prices are going to increase. So, the real estate market generally, even after 2008, the crash, it still appreciates in it bounces back quick.
Yeah.
I mean, in 2008, we went through the whole banking crisis and crash. Properties plummeted, equity and everything like that. By 2014, they were higher than they were, ever.
Right.
And then they just kept going up. Yeah. So, to that point, and anyone that is on the sidelines and everything, there's never a good time. Like you just got to, if you think if it's a good time for your family, meaning like you need the space and stuff like that, you just got to do it because you can't wait on the rates. You can't wait on the property values to plummet because it's just, you can't time it. It's just like the stock market. People say it all the time, right?
Yeah, time in, not time in.
Yeah. You're not going to time it and hit that GameStop crazy, $3 to 120.
Yep.
Like it's very difficult.
Yeah. But yeah, I mean, you gotta prepare as well. I mean, that's something where obviously, like I said, I'm looking on Zillow and just keeping an eye out,
100%.
See what's out there and everything. And with that, something I've learned through like Harvest Group and all this stuff is kind of reverse engineering everything, right? So, here's where I want to be, and what's that going to cost? How do I get there? And what is that? When I'm looking at the bottom line, okay, I'm looking at a house that's going to be taxes, lawn care, just general maintenance, mortgage, all that's insurance, everything.
Yep.
Right. So figuring out, where do I need to be to get there, and what can I do today to make myself one step closer? And that's something over the past couple of years I've become a little more, I don't want to say obsessive about, but is working on taking steps to be in a place where I can take advantage of opportunity. Right? So I'm work on budgeting and saving money and not spending on stupid stuff, and being in a position where when the moment comes and that house comes that I really want, I'm in a position to make an offer, and it takes a lot of discipline. It's funny, working with my wife. Like I said, we're a team. She's one who's taken some training as far as getting onto the
the budgeting
train.
Let me know how that goes. But I've been trying to work on that for.
I'll tell you what, it's going very well.
Is it?
I'm
you got to share with me how you did that, because I'm still working towards that one.
Yeah,
she's probably going to listen to this too.
Yeah,
maybe that's the wake up call.
But no, she's been great as far as understanding the importance of all that stuff.
Yeah,
and coming up with a plan to be more not successful at saving and at being smart with your money.
Yep.
And I think that's just as important as making money. I want to increase income and save more of it.
It's all about the bottom line.
So and that's through discipline and just figuring out what's the best place to put the money. Where do I how do I go about doing that? So that's something I've really worked on the past couple of years that I love doing. Now it's like I when you save money, you look in the account, and it's
That's
more than it
awesome.
was yesterday.
Yeah.
It's very
awesome.
rewarding, and I'm
great.
addicted to having
That number going up.
that number going up.
Yeah.
So it's gonna suck when I have to spend it.
Yeah.
But
It does. It does.
but,
It's always bittersweet in the moment.
yeah.
But if it's like an investment opportunity or something like that, then you're like,
excited.
exactly.
it's fun.
But yeah, it's so that's been something her and I've like worked on and everything, and it's been great. I mean, she's awesome, and she's
it's important that you guys
partner,
are like
so.
setting that groundwork early. I think where we probably messed up is we didn't start to have those conversations.
I wasn't
at
at that.
kids.
We got married when we were young, right?
Well,
How old were you
yeah,
when you got married? I was 28.
25, 26.
So we were younger than
Yeah.
most people today,
Yeah.
So like I wasn't thinking about, I mean, I was, but I wasn't like I am now.
Yeah. I would assume too, like I said, we probably weren't making the money back then we are now.
True. Yeah, right.
We didn't have all the the responsibilities that we have
Yep.
now. It's kind of tough when your wife's thinking about 4 other kids, 3 other kids plus you.
Yeah.
And you're like, stop spending money. And she's like, well, it just costs $400 a week for the groceries.
Yeah, that sounds
I don't know what to
sounds
tell
like my day.
you. Yeah, you're like, I don't know what to tell you.
Right. Well, this is easy for
I
me
only
to
went
say
to
as someone
Target
with
for
no
2
kids,
things.
Yeah. So.
But the fact that you guys are intentional with it and you're not, because I think most people, like when I look back, when I was probably from 18 to 25, the vast majority of the money I made back then all went to
I don't know
like
where it went.
sneakers.
I don't know where
and,
mine
like,
went.
But it's thankfully
Well,
some
I'm
of it
not
are
saying
things I
that
still
mine
have.
didn't either, but
But you've
gotten on it
decided
better.
to at least get on the same page because that's
Pre-kids.
important. Like, to
Right,
have
right.
those financial discussions because too often we don't do it until it's like becoming a pressing matter where you're really making it at the forefront. So you guys have a vision for where
You're setting the
going and
foundation.
why.
You're laying that
Exactly,
foundation, right?
exactly,
And
yeah.
it's all about, everybody talks about it, paying yourself first, right?
Yeah.
So you get that paycheck, paying yourself meaning saving,
Yeah,
right?
right.
So you put that, money there. What I've always heard is you should match what your bills are.
Mhm.
So you have your bills, you pay them, then you pay yourself, that same amount, and now you got whatever left over to go buy those shoes or to go buy that, what watch or whatever, right?
Yep.
So it's important to lay that foundation in your marriage.
Yeah,
Have those
absolutely.
different
Because it's going to
buckets.
it's going to get tougher. Marriages are tough.
Yeah.
It's
Absolutely.
going to get tougher once the kids come. It's going to be stressful, but you have that foundation set to where, to Justin's point, you're not coming home. Stop spending money.
Yeah.
What's
What's going on here?
Well, we have 3 kids and you want to eat healthy. So, spending $400 to shop right every week.
Yeah.
Yeah.
Now, how I get this question all the time, so I assume you probably do too. What's the dynamic and how do you enjoy working with your mother, right? Because I feel like so many people are like, I don't know how you work with family, and like
Yeah, you hear that all the time.
instantaneously you already know you're like, man, your family's obviously got some rifts in it. If you're coming at me that hard, you could never do it. So what's your experience been?
I love it. It's been amazing. I mean, my mom and I are 2 peas in a pod. We get along very well. We're on the same page. I'm trying to grow the business, and she wants me to grow the business so she can back
Phase
off
out.
a little bit.
Absolutely. Yeah.
So it's the great thing about working in a family business is your boss has your best interest in mind, right?
100%.
100%.
Right.
They want you as much as you want to be successful. They want you to be successful. So they're gonna my mom has been a great mentor and a great coach as far as running the business. She's we're very good about kind of leaving work at work, where on the weekends, maybe a little bit we'll talk shop a little bit, but we can kind of separate the two and
That's good.
and have a fine relationship, whether it be talking about work or just life in general. So, it's great working with my mom. She's got, her clients that are her friends and everything. And she's handed some off to me that I handle now. And then I've got mine that I brought in. So, it's funny, I'll come home from work and Nikki will ask me, she's like, oh, what did your mom say about this? And I'm like, I didn't even talk to her today.
Yeah.
She's in the other room.
Yeah.
We're kind of doing our own thing. And
Yep.
my path with starting at Saratoga. So when I graduated from college, I worked at Arthur J. Gallagher for a couple of years, and they're a large insurance brokerage firm.
Yep.
I interned with them in college, and then I started working for them, and I worked for them for about 2.5 years out of college, and was fairly successful over there, and kind of proved myself. at about 2.5 years, my mom partnered with a company called BCA Insurance Group to do property and casualty stuff for business insurance and whatnot. And at that point, I left Gallagher and joined her and was able to, do PNC stuff for our benefits clients while I learned the benefits business. And at this point, I'm out of the PNC pretty much completely. But it was great where, I was able to come in and have some value on day one. I didn't come out of college and say, this is, I'm working for my mom and I got to learn everything from her. I had some experience. I had some skills, and I was able to, kind of talk the talk with our clients from day one. As that, transitioned, I've been, learned the benefits business a lot. And I actually started my own business in January of 2021, I believe. Yep, January 2021, doing Medicare consulting. So we were getting a ton of questions from all of our existing clients asking about, Medicare. I'm turning 65. What do I do with health insurance? And I was kind of sending it out to another guy. I was getting so many calls about it. I was like, I can do this. There's an opportunity here. So I took that and was, I kind of broke that out as my own like sister company to Saratoga Benefits, Saratoga Medicare Advisors, which has been great. I mean, that's like my baby. That's my business. It's my own LLC. I own it. I'm totally responsible for its growth, its success, and all that. And it's been amazing. I mean, just the experience of kind of running a business, albeit, small, but growing. It's nice to, working with my mom. We kind of have our own things that we're working on. So they're related, and, we talk about them and work together all the time. But at the end of the day, we each have our own responsibilities, our own clients, all mission. That stuff. So, it's easy when you're not, kind of relying on your parent or your sibling or whoever it is in your business, for leads or
clients
for
or
clients or for whatever it is.
You're doing your own thing.
Yeah. And, it's been nice. I mean, my parents are old school. There are no handouts, there's build your own client list and they're happy to help out where they can, but they want me to build my own thing. And I love that, it's great. It's gritty. It makes you, work hard. It's been great. So I do, in short, I love working with my mom. She's been a great role model, and she's run a great business. I mean, 25 years in business is
it speaks
impressive.
volumes.
So,
absolutely. Yeah, it speaks volumes.
Yeah.
It's cool to just see them in that lens too. Like when you really take the step back, it's one thing, for her to be your mom and be the nurturer and know her from that role, but to like watch her mom step into like that boss mentality.
Yeah.
It's just like to see them handle it. It's really, it's inspiring at times. And I've always said like my family is predominantly women. So I've been surrounded by very strong, independent, outspoken women my entire life. And you unfortunately don't see a ton of that. We're seeing more of it. There's a lot more women coming forward in the workforce with that personality. But like, there's not a ton of sharks.
Yeah,
I feel like both of our moms are like those sharks that you could probably throw them in almost any industry, and they would figure out a way to succeed.
Definitely, yeah.
And it's really nice to just have that as like your example, right? Because like you said, you already have the confidence that they have your best interest in mind. You literally get to see them. You just get another level and perspective of them that like a typical boss wouldn't give you access to, right?
Absolutely.
And it's going to make us both like age wisdom wise well beyond our years.
Yeah, definitely. And it's growing up, it's wasn't always easy, I mean, mom had work all the time, she has a business to run. On top of playing tennis all the time and doing all her networking. She was the queen of networking. I mean, she was involved in everything, every board, every chamber, every rotary, everything. So, it was, she worked hard. I mean, she built her business from nothing out of the attic and 25 years later, it's still here. So, it's funny, a lot of my friends had maybe stay-at-home moms or whatever it is. And I certainly didn't have that. It was, a lot of times TV dinners and whatnot, but, cause mom had, a networking event or something to go to, but, a great example of, how to grow a business the right way. And, what it takes as far as kind of giving back and, paying it forward and, the benefits that come from doing that. So, it's been a great example and she's been a great person to learn from.
Love that. Shout out to Amy.
Yeah.
Go. Why don't
Get
we
to it?
Yeah.
All right. So I ask this at the end of every episode. Can you give us a struggle or a failure that you've had, any point in your life, but that really gave you, a big lesson that you still kind of use today?
It's a good question.
You take your time. This one always
This
one always does it.
Joe will cut the in between. Take a second.
Yeah.
Think about it.
I mean, the struggle is, I would say, as has just been. So I've been in sales since I was young. So right when I got out of college, being a young guy having to kind of prove himself with, I didn't have the beard I have now, and I was a little bit younger and having to prove that I knew what I was talking about. I could add value to a client and all that. So that's been kind of an uphill battle that maybe I'm just kind of getting over now that I'm in my 30s, but that's something that's just perseverance, learning, and figuring out what value you can add.
Yep.
I think my dad always says the best thing you can be is a subject matter expert, right? So learning as much as I can about health insurance, right? About the different benefit models for businesses makes you invaluable. So it's not easy. You got to learn everything all the time. You got to stay on top of all these new trends and all this stuff, and be able to kind of monetize that and make it valuable to our clients. So staying on top of that and learning and becoming an expert is something that's a challenge for everybody in any industry, and that's been a challenge for me and something that I try to stay on top of and do the best job I can as far as being the best that I can and make up for maybe my lack of gray hair, even though there's, I'm going to look like Tyler in a couple of years.
God.
With knowledge and knowing that, I can advise people in the right direction. So, that's always a challenge that's ongoing and something I try to learn from and bring into everyday life.
Yeah, no, I think that's a great one because I think probably Justin, you faced that. I've definitely faced that. We started our company 2014, so I was 22. So, same kind of thing. And it could be intimidating walking into a room where, there are all those gray hairs, like you said, and you're like, oh, I'm like, 20 years younger than everybody. But, like to your point, you become that expert, you talk the talk. And then it's like, I feel like it's more powerful when you're talking to those people, that 50-year-old, say, and you're talking the talk. And from what I've always, heard, like the guy will be like, oh man, you're really sharp. You're a go-getter. You're a young go-getter. And it makes you feel good. You're like,
absolutely.
Absolutely. And, at some point really the things just kind of start to click, right? Like the gears start to turn and, for my first couple of years going out networking, whatever it may be, I wasn't getting all that much return, right? I'm a young guy. I was, trying to figure it out and do all that. But then eventually you keep showing up. All right. You keep learning, you keep talking to people, you work with one person, they tell someone about you, they tell another person.
Spiderwebs.
And eventually you're, you've got a great network of people that are, referring you business, trust you. You can grow from that. So, through that, I've gotten a lot of referrals. That's our main source of new business. And that's all through trust, and knowing what we're talking about. So, and proving that to people. So, so that's been, something obviously I always try to work on, continuously work on. It's definitely a struggle, but it's something, I feel like some people maybe rest on and get behind, and you got to just keep up and
keep moving forward.
Keep moving forward.
That's it.
Yep.
What's the imposter syndrome, right? I think it's actually a good thing. I think people get very nervous about it, but it's cyclical. It continues to happen in life in different ways where you become uncomfortable. Originally, it was just to network, right? And then you get very comfortable with networking, and then you get into rooms that you're like
presenting,
man, or you're in a room where you're like, all these people make way more money.
Yeah.
And you're kind of like, damn, am I worthy to be in this room? And it's the consistency, like you said, of showing up, of failing, of being told no, of, something, the deal crashing and how you rebound from it. But you learn all those things. You become stronger. You become better. It keeps showing up, and then you build your confidence, and you can walk in any room. Next thing you know, you're on podcasts and you're interviewing people and doing stuff like that.
Yep.
So, Bill, we really want to thank you, though, for being here with us today,
thanks for having
sharing
me, guys. It was great.
The journey and the story. And friends, make sure to continue to tune in. Have the best day ever, and we'll see you on the next episode.
Best day ever, fam.
Best day ever. Thanks, guys.
Boom.
Appreciate it.